Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our Wednesday news conference for the latest in COVID-19 information for the Amarillo community. We do these every Wednesday at 11 a.m. Let me go ahead and introduce who is joining us on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to turn it over to our panel for some brief opening statements, and then we will take questions from our media. At this time, we'll now go to Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you, Dave, and good morning, Amarillo. Yesterday, we had a visit from U.S. Senator John Cornyn, and he spent a lot of time wanting to know how the Federal CARES Act money has hit our city and how our community has used it and what we've needed it for. And I thought it would be good to give you a summary of how this Federal CARES Act money has been used in our city. It's millions of dollars, so we don't have time for me to give you every single penny and how it's been spent. But let me just hit a few of the highlights. We've used CARES Act funding to keep our city buses running in the city. And during COVID, citizens have been able to ride the bus at no charge. The airport has stayed open, and we've continued to make repairs and infrastructure improvements despite the loss of revenue from all of the many canceled flights. Our health department has conducted over 6,000 tests in a drive-through testing center, and we've contacted over 50,000 people in connection with COVID contact investigations. We have supported those experiencing homelessness or possibly living in a shelter as a result of, well, not just as a result of COVID, but those folks who are in a more vulnerable population. We've had dollars to put into those programs. We've supported people who needed rent assistance. And just as a reminder, all of our COVID testing that's offered through the city has been at no charge. So it doesn't matter what your income status is. If you've come to the city for a test, that's been given to you. We've also supported small businesses who've been greatly impacted by the change in our economic circumstances through COVID. So if you've had a business interruption or you've purchased safety equipment for your business, you very well may have qualified for hundreds of thousands of dollars that we as a city have given out to small businesses in the city. So that's just a high summary, high overview and a summary of what we've done with our CARES Act funding. And I really appreciated the senator making a visit to our city. And I told him just how proud I am of our local medical staff, the leadership that we have in our hospitals and in our health department, and how well they've worked together as a team for months now to continue to weekly, daily evaluate where we are with COVID and what we need to be doing as a city to stay on top of it and anticipate the needs that are coming. So I am proud of this team, and many of them you see on this press conference every week. So I just would take this time to thank each one of you for the work that you've done for the city. And the end is not necessarily in sight, but I know it exists. So let's keep going, and we'll keep working together to take care of Amarillo. And we appreciate the help that we're getting from you as citizens in washing your hands, keeping your distance, wearing a face mask, and most importantly, staying home if you feel sick at all. Thank you, Dave.
Thank you, Mayor. This time, let's now go to Public Health Director Casey Stoughton. Casey, how are you this morning?
I'm good. Thank you, Dave. I just want to go over the numbers real quick. So as of yesterday, there were a total of 5,844 cases of COVID-19 reported in Potter and Randall counties, 3,866 in Potter County, 1,978 cases reported in Randall County. We have a total of 5,276 recoveries. Each of those recoveries we're thankful, and we do have a total of 75 deaths reported in our community. We are our hearts go out to each of the families who have lost loved ones to this disease. That leaves us with a total of 493 active cases at our 2:30 report card, these numbers will change. So tune in to AmarilloAlerts.com, and you'll have the most up-to-date information with regard to case counts. I do want to take a moment to let you know that each of the cases do represent a unique individual. Our staff here at Public Health take the time to take out duplicate tests, as we don't count multiple tests for the same individual. The public health drive-through does remain operational. Like Mayor Nelson said, those tests are free of charge for anyone who comes to the public health drive-through. You can call 378-6300 and our call takers will screen and direct you for testing. As school is opening, we've had many of our students in Potter and Randall counties go back to school this week. Just a reminder, masks, social distancing, hand washing, staying home when you're sick. Those are the things that we need to do as a community to continue to keep our students, our teachers, our faculty, administrators, and our loved ones safe from COVID. So we appreciate all of the hard work that you're doing as a community, and as our teachers and everyone are doing. This is certainly a new environment, with some students going back to school in person and some going to school virtually. Also want to just take a moment to remind everyone, if you're in need of immunizations, the Public Health Department is offering immunizations by appointment. So you can also call 378-6300 to schedule your immunization appointment. During this back to school time, those immunizations are certainly important, as always. So that's all I have today, Dave. Thank you.
Thank you, Casey. We'll now go with Dr. Scott Milton, Public Health Authority and Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good, Dave. Good morning, and how are you, and how's the panel doing?
We're good, thank you.
Good. So once again, let's remember to wear a mask and practice social distancing as best we can. One thing I thought that might be interesting to maybe discuss this morning, maybe with Dr. Weiss and Dr. Lamentier, about some of the changes in the CDC guidance in terms of testing and isolation, which has moved more away from testing as opposed to a length of time and symptoms. Essentially, if you are confirmed positive, you're asked to isolate for at least 10 days and possibly 20 days if you had severe disease. But it also has an impact on how the hospitals function in terms of testing and in terms of scheduling procedures, et cetera, when someone's been previously diagnosed as positive. I know that Dr. Lamentier and I a couple of weeks ago had a discussion about a patient that was kind of complicated. But I think essentially these guidelines are very helpful in that we're moving away from trying to rely on testing, which can sometimes be confusing in that individuals may actually be shedding virus for a significant period of time but are not infectious. So maybe a couple of minutes today that we could spend on that with the discussion between Dr. Weiss, Lamentier, and myself about that. That's all I really have today, Dave. Thank you.
Thank you, Dr. Milton. Now I'll go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
I'm doing very well. Thanks, David. Hey, good morning from Northwest. A lot of the conversation about hydroxychloroquine was this idea that maybe this was a medication that people could take that would help them do better if they were to contract the virus. And I think, as Dr. Lamentier and Dr. Milton and I have all said, that has not turned out to be the case. However, there may be actually a cheaper and safer alternative. So there's been a lot of interest recently in vitamin D. And interesting, it's long been known that vitamin D does have effects on the immune system, and it's been known for many, many years. There's been some interesting observational studies published recently that have shown that in patients who are sick in the ICU, on average, have lower vitamin D levels than those patients who are COVID positive on the floor or at home. Now, this is very important. This is a correlation. This is not saying it's a cause and effect. And we have not seen studies yet that have proven that low vitamin D levels can lead you to do worse with COVID-19. However, the caveat is vitamin D is just good to take. All right? Most of us do not spend enough time in the sun to generate enough vitamin D for ourselves. And I would not recommend spending that much time in the sun because we know that is dangerous. However, vitamin D3, you can take 1,000 to 2,000 international units a day. That is recommended. The cheapest vitamin D3 you can find. And it may actually help you do better should you contract COVID-19. So it's a safe intervention. We know it's good for your bones. It's been shown to actually reduce falls in elderly patients. So vitamin D3 is a good supplement and may actually have some implication for COVID-19. The other thing is, as Casey pointed out, is please get your flu shots this fall. We know that the flu and COVID-19 is a bad 1-2 punch. And so if you can protect yourself from the flu, again, that's something you can do that we know is safe, reasonable to do, and may be helpful in these situations. Let's talk about the numbers in Northwest. Right now, we have 23 positives in the hospital. You could argue that maybe we're seeing a slight decline. About 2 or 3 weeks ago, we were hovering in the high 20s or low 30s. Now we're hovering in the low 20s, which is great. Okay, so 23 positives. We have 9 in the intensive care unit. 5 of those are on ventilators. Right now, we're using 18 of our 40 ventilators in the hospital. Interesting, we've talked about how all ages are being affected in this current surge that we're seeing. We now have an 11-day-old in our hospital that is COVID-19 positive. That is the youngest patient that we've had test positive in the hospital. And this patient came from an outside facility. We've also had several mothers who are COVID positive give birth to babies here. Typically, we test those babies at 24 and 48 hours after birth. Thankfully, none of those infants have been shown to be positive, despite mom being positive when she delivered the baby. Now, in regard to treatment, we are continuing to use Decadron on every patient in the hospital, or dexamethasone that's COVID-19 positive. We are now becoming critically short of remdesivir. And this has become a problem. Our distributor is not being able to guarantee us when we would get more shipments of remdesivir. So we're having to be very careful with our use of that medication. Regard to PPE, we've really had no problems with personal protective equipment. We've been hoarding it for the last several months, so we're in pretty good shape right now in anticipation for the fall. Now, to talk about what Dr. Milton was referring to, so testing is interesting, is we are still seeing patients test positive upwards of 5 to 6 weeks out from their first positive test. But they've been asymptomatic for weeks, meaning they've had no symptoms, but are still shedding the virus. And that's tricky. We know we're allowing some of our employees to come back to work who may still be shedding virus, but have been asymptomatic, as long as they wear a mask at all times in the hospital. The question Dr. Milton raises, what about elective surgeries? Are we allowing people to undergo procedures or elective surgeries if they test positive, maybe weeks after having symptoms? And this is a bit of a debate. If it's an emergent or urgent surgery, absolutely. But there's still some data to suggest that people don't do as well after surgery if they have the virus versus if they don't. A lot of these studies are not indicating whether they've looked at symptomatic people versus asymptomatic. So we're still being very careful about trying to hopefully wait until someone is free of the virus completely before we do a completely elective procedure. But again, still a lot of questions around that. And then finally, our visiting hours remain from 9 a.m. to 1 p.m. We still find that's the best time for loved ones to come in and listen to what the doctors are saying when they're rounding, but we are sticking with those visiting hours right now, and typically no more than 1 visitor per room in the hospital. But finally, we've heard a lot about the preparations for school restarting, and I want to personally thank everyone that's been involved in that. I know there's been incredible amounts of work in try to keep the children safe as they come back, and we just say that Northwest Texas is here to support however we can the needs of our teachers and faculty and students as we return to this normal routine of life. That's all I have for this morning. Thank you.
Thank you, Dr. Weiss. Now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you this morning?
I'm doing well. Thank you for letting me speak today on this panel, and I appreciate everybody's collaboration and participation since the outset of the pandemic. So BSA is happy to be a part of this discussion. You know, our statistics today today's a sort of a landmark day for us here. I mentioned this on our leadership morning to our leaders that we had earlier today. It is exactly 5 months today since we had our first COVID confirmed inpatient, which was on March 19th. So this has been a long haul for all of us in the community, all the healthcare workers at both hospitals, the ICU nursing staff, the med-surg nursing staff for all facilities, and physicians that have been caring for these patients for 5 long months and still going strong. So we need to make sure that we recognize them still and not let that recognition fade when we see them out in the community, and thank them for taking care of their loved ones during this very difficult time. We're down to actually 18 patients today confirmed in-house. Now, a couple things. We've not been down at 18 since the 4th of July. Temporally, I think that's interesting that after the 4th, we spiked up again, and now we're trending back downward. I think Dr. Weiss confirmed that our numbers are running pretty much parallel with one another. We may have a couple more patients in one hospital versus the other for a single day, but then we really are hovering pretty closely as a city in terms of the inpatient load. We've also now had over 450 unique admissions since the outset of the pandemic at BSA. That is a significant number of patients that we've cared for. If you add that to the number that Northwest has admitted, it's probably just about double that number. And that's a lot of patients for our region. I want to stress what some of the folks have already said, and that this is the time of year where we're going to start getting our flu vax inventory. And it is absolutely critical that everyone get the flu shot. And there's no question in my mind, I think there's no question in most of the health experts' minds that getting the flu shot will diminish the risk of you having a potentially more severe clinical course if you, by chance, get infected with COVID-19. There's also no question that co-infectivity is a possibility. We've seen that. And having an infection with COVID-19 and another serious viral illness is only going to increase the odds of a worse outcome. So please be compliant with getting your flu shot. We're going to be really stressing that for folks to help offer flu shots for those that we can. And I know a lot of our institutions across the city will be doing the same. From a treatment standpoint, we are currently okay with our supply with remdesivir. We have treated at least 64 patients to date with that drug. Most of our patients are getting the shorter clinical course in an attempt to try to conserve the inventory, but also being very consistent with where the trial showed benefit, starting it early and stopping it early, as opposed to continuing the drug for a longer period of time. Most of our patients are getting dexamethasone, as Dr. Weiss mentioned. We've treated over 240 patients with that drug. That's unique patients, and we started early with that therapy. We are also about to start off as a participant in the Regeneron trial, which is an anti-coronavirus spike protein drug that has been shown to have some very early potential benefit. Again, as with any clinical trial, we really don't know whether there's going to be an overall positive impact until these studies are completed and the data is then reviewed retrospectively. As far as the convalescent plasma trial, there was some data that came out today that's published in the New York Times regarding a hold being put on the emergency use authorization for that therapy. And that's simply because the data needs to be scrutinized more heavily before there is support for a therapy that is felt to be potentially helpful. Clearly, there's been some early data that suggests that convalescent plasma may be beneficial. I think anecdotally, we can probably comment on multiple cases that we've seen patients improve. But again, the reason we do good trials is to make sure that we're not making claims that aren't supported by larger numbers and well-done studies with controlled groups and folks getting placebo versus active treatment, which really helps to eliminate some of the questions. At BSA now, because of our declining numbers, which really started to slowly drop last week, we're back to opening up visitation to what we call a yellow status. We were no visitation prior to Monday, and as of Monday, we are allowing 1 visitor per patient. We are asking that there be no more than 2 visitors maximum per day for any single patient, and our visiting hours are 10 a.m. until 8 p.m. Again, there are situations that we are making exceptions for end-of-life care, but we're working with families, we're working with nursing staff to make sure that we're keeping our staff safe, keeping our patients' families safe while we're allowing visitation appropriately. If we talk about briefly some of the changes in our testing, we've noticed that our overall positives for the month of August are down to about 12%. 20% of our tests were positive in July. So we're seeing a drop off there as well. When you look at the 7 and 14-day trends for our region, we're still in that kind of 80 average new cases per day, but that's also starting to dwindle a bit. So it may be that, again, we're on the downslide here of this bimodal curve in our case incidence across Amarillo. And to comment on the preoperative elective surgeries, I agree with what's been said by Dr. Milton and Dr. Weiss. I appreciate Dr. Milton's help working through some of these difficult cases where we have a lot of questions from families and others that are asking about why certain cases are moving ahead or not. And again, not every case that's elective is truly elective. What I mean by that is, if it's not an emergency case, it's pretty clear what's emergent and what's not. But some cases can't wait for weeks because there's going to be morbidity for a patient. So again, we need to make sure that we're choosing wisely. Our preoperative testing has yielded a less than 1% incidence of positive patients for COVID. 0.8% we're at now, which means that the protocol we're utilizing is probably over-testing individuals, which is fine right now. However, it's also pointing out that we have not had any cases where patients have come through surgery. We found out that they're COVID positive thereafter, and they've had a worse outcome. So Dr. Weiss is correct about the literature, and we're worried about that as well. But to date, with the screening that I think we're doing at both facilities, we're having good outcomes with our elective cases. So again, I really appreciate being on here today. I want to shout out to all of the healthcare workers in the city of Amarillo at every institution, every facility, whether you're in acute care, post-acute care, you're all doing a yeoman's job of really making sure that our patients are safe, putting yourselves at risk, and we thank you.
Thank you, Dr. Lementier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Good morning to the Amarillo community area and the Texas Panhandle area. I just wanted to report first, we commonly refer to our 3 things to do to help prevent the spread of COVID: wear a mask, social distancing, and good hand hygiene. As echoed by everyone before me, but I think we have a 4th. It won't necessarily prevent COVID, it prevents that multiple infections, is get your flu vaccine. So to get the influenza vaccination or the flu shot is another key thing we need to be doing. So here at the Amarillo VA, we currently have 0 COVID positive patients. We do have 21 veterans we track that are on home self-quarantine, but we do not have any inpatients today. One of the things I made a decision late last week is we were going to go ahead and expand our number of available face-to-face appointments for routine care. As was known several months ago, we went down to virtually 0 routine appointments and only urgent and emergent care for face-to-face. Well, we've been slowly expanding, and so on 31 August, we're going to go ahead and increase that number. To help prepare for that and talk to our veterans, on 27 August, I'll do a teletown hall with some veterans to explain to them what we're doing and answer any questions or concerns they have. I also wanted to mention today, this Saturday is going to be the 65th anniversary of the start of the Vietnam conflict. And so, I'm a veteran of Operation Iraqi Freedom, and I know the accolades that we got coming back. I actually still remember coming back in the airport and what was done. And I know not the same was done for our Vietnam veterans. And so please take this time, if you know a Vietnam veteran, to say thank you for what they did. It's a great time to remember our veterans and what they do for our country. And so, as always, I want to thank our VA staff for what they're doing in response to this pandemic and how they're supporting this community and the communities we have sent some to help out, and thank the city of Amarillo for this opportunity to speak to our veterans. Thank you.
Thank you, Dr. Gonzalez. Now go to City Manager Jared Miller. Mr. Miller, how are you this morning?
Doing good. Thank you, Dave. Just want to remind everyone the drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300. You'll be screened for the drive-through testing center. We continue to be under the governor's executive orders GA-28 and GA-29. Under GA-28, there's no occupancy limits on, in other words, 100% capacity on essential critical infrastructure, religious services, local government operations, childcare services, youth camps, and recreational sports programs for youth and adults. There's a 50% occupancy limit on outdoor areas, events, and establishments for professional, collegiate, or similar sporting events, amusement parks, swimming pools, water parks, museums, and libraries, also zoos, aquariums, natural caverns, etc. Every business is operating that are not essential businesses are operating at 50% capacity. In addition to that, bars are closed and were closed effective June 26th. They can continue to provide takeout or delivery of food and alcoholic beverages if authorized and as authorized by the TABC. We're also under GA-29, which is a standalone executive order of the governor relating to the use of face coverings during COVID-19. Under GA-29, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when they're in an outdoor space, wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. The face covering requirement does not apply to the following situations: any person younger than 10 years of age, any person with medical or disability that prevents wearing a face covering, any person while the person is consuming food or drink or is seated in a restaurant to eat or drink, any person while the person is exercising outdoors or engaging in physical activity outdoors and maintaining a safe distance from other people not in the same household, any person while the person is driving alone or with passengers who are part of the same household as the driver, any person obtaining services that requires temporary removal of face covering for security purposes, like removing your face covering to do a face ID for a credit card or something like that. Finally, any person while the person is in a swimming pool, lake, or similar body of water. It's also highly recommended that in situations where it's not actually required, but still recommended, like in a religious worship service, it's not required, but wearing face covering is strongly encouraged. And that's it. That's all I have, Dave.
Thank you, Jared. At this time, we're now going to turn over to questions from our media members. We have a question for an individual panel member or the panel as a whole. That's perfectly fine. Let's go ahead and start with Vanya Patino, a reporter from KFDA News Channel 10. How are you this morning? Vanya, how are you this morning? Okay, let's try. We'll come back to her in just a second. We'll try that again. Vanya, how are you this morning?
I'm doing good. Thank you so much.
Some bad audio there. We'll come back to her in just a second. Vanya, we'll come back to you in just a second. Let's go to David Gay, Globe News. David, how are you?
I'm good. Can you all hear me?
And perfectly. Thank you.
Perfect. I guess my first question is specifically for Dr. Weiss, but I'd love to hear Dr. Lamentier's opinion on this. With the remdesivir allotment going lower, do the hospitals have a treatment plan, I guess, to focus on after that the remdesivir isn't available anymore?
Well, not particularly. No. So we've been very careful on choosing the patients that receive that drug. And I believe Dr. Lamentier mentioned, what we know is that it doesn't work well when people are extremely sick. And so what we're finding is that if you start it early and intercept these people who look like they're just starting to get sick, what it allows is that they show a better response, and we can also shorten that duration from 10 days to 5 days. And by 5 days, you're already seeing a pretty strong clinical response. Keep in mind that the remdesivir did not show a reduction in mortality. What it did is it showed a reduction in the length of hospitalization. So while we think it has benefit, obviously getting people out of the hospital is great. The biggest thing is that Decadron appears to be also a critical part of how we're treating people, and then just excellent supportive care as best we can to keep them off the ventilator is really the plan at this point.
So just to make sure I'm understanding correctly, while remdesivir may be gone, other treatments can be used to maybe not have them out of the hospital as quick, but to help them get over this COVID-19 virus that they have, correct?
Absolutely, David. I think Dr. Lamentier mentioned it a couple of meetings ago, but it's been shown that when people get onto the ventilator, they tend to do worse after that. And so really the efforts I think both hospitals are making, or all three hospitals are making, is trying to keep the patients off the ventilator. That includes aggressive pulmonary care, proning, even when they're on the ventilator, is actually have them turn on their chest and abdomen at times to help them breathe. But any efforts we can make to keep them off the ventilator seems to be the benefit of that patient.
Absolutely, absolutely. And I guess my next question is also for the medical professionals in the room. There's been a lot of talk during this meeting about the flu vaccine and the importance of getting the flu vaccine. Have we had any cases here locally where we've seen the flu or a virus like that affect a patient with COVID-19? And I guess what happens when those two kind of merge? I know Dr. Weiss talked about how it's a nasty 1-2 punch.
Yeah, I mean, this is Dr. Lamentier. I would just say to support what Dr. Weiss said first, that yes, I mean, the mainstay of therapy for COVID-19 is supportive care, which means that we do everything we can to keep patients alive with ventilatory support if needed, high flow oxygen, IV fluids, other supportive care that repletes their deficiencies in terms of electrolytes, and other metabolic derangements that they can get with COVID, clotting disorders and the like. And although remdesivir is a drug we utilize, dexamethasone is another critical one, as mentioned, that did show a survival benefit. And I think that as we see more trials that are going to be done with larger numbers of patients, we may see different things happen with drugs like remdesivir and dexamethasone that are showing either more impressive results or potentially less impressive results. So again, that's the problem with not having a long-standing track record of good randomized controlled trials. And again, we're going to get more and more data back, and that's going to help us make some of these difficult decisions with as these studies come forth. And yes, I can say that absolutely, we've had some patients here. One specifically that I'm remembering that had a co-infection with influenza and COVID-19 and did not survive at BSA. So again, the combination of those viruses, we know that the mortality rate with influenza is significant. The flu kills thousands of patients a year in this country. We can't forget that. So when you add another significant respiratory illness like COVID-19 on top of that, and you have nothing to help fend off either or organism, and an immunization is one of the best ways to fend off a virus, then you're going to have a potential for a worse outcome.
Absolutely, absolutely. And I guess the last question that I have is for the Mayor Nelson or Jared Miller. I know that during yesterday's news conference, Senator Cornyn spoke about the potential of getting a second round of CARES Act passed. If that is, a conversation, what could a second round of funds from the government do for the city and continue to help the city as we go through this pandemic?
Jared, you want to go first?
I think it'll provide additional capacity for us to assist businesses that have had significant adverse impacts. There's also significant lost revenues to the city itself and challenges with providing city services. So there's a possibility that there might be some opportunities there. There's a lot of projects that we didn't do this year, infrastructure projects and things like that. Not knowing what all strings might be tied to additional CARES funding, it's difficult to say exactly what the projects would be, what those funds would be applied to. But I definitely think the focus is going to be on providing assistance to citizens and businesses that have been adversely impacted by coronavirus, along with trying to continue to provide infrastructure projects that may have been bypassed due to funding shortfalls.
And I would add just to that the current funding has limitations and restrictions on how we can use it. And there's been a lot of conversation about the fact that there's funding still available that doesn't fit the initial criteria that Congress or Austin set up to steer those funds, and we'd like to have access to those funds just to help us make up revenue shortfall as a result of loss of sales tax and loss of hotel occupancy tax. So that combined with the initial funding kind of the idea was kind of carry us through December. And I think we all have feel that this is going to last longer than December. There is an end to it, but it won't be over by Thanksgiving or Christmas. So there needs to be a plan for how we extend some of the services that we've been providing, especially the public health department services. We need to carry those out on a longer time frame, and we're going to need assistance to do that.
Absolutely. That's all the questions I have. Have a good rest of your week, y'all.
Thanks, David. We're going to try this again now. Let's go back to Vanya Patino, reporter at KFDA News Channel 10. How are you this morning?
I'm doing good. Thank you so much, David, and everyone else for your patience. I really appreciate it.
No problem. That sounds great now. Go right ahead.
Thank you. Awesome. So I know Dr. Lamentier mentioned the positivity rate at BSA was going down. So I was wondering if Casey or Dr. Brian Weiss, have y'all seen kind of the same thing, and what is their positivity rate at right now?
So the community as a whole, the positivity rate is right around 12% for the entire community for the duration of the COVID event since March. And so I think that's, that's for the entire event. For the drive-through testing, we're testing only symptomatic patients, and our positivity rate for the entire time that our drive-through testing has been available is right around 21%.
I would just say at Northwest, I can't give exact numbers, but our amount of testing per day is about the same. I say 3 or 4 weeks ago, we were getting 5 to 8 positives a day. Now we're getting 1 to 4. So I'd say anecdotally, yes, we're seeing the same that Dr. Lamentier mentioned, is we are seeing a reduction in the percent positives over the last couple of weeks.
Got it. Thank you so much, both of you. I was also wondering, when the delay in active cases was reported, it was said to be due to reporting from outside sources. So Casey, I was wondering if you knew who those outside sources were and what caused the miscommunication.
Sure. So wasn't really due to a miscommunication, but we have a reporting system that we use through the state of Texas called NEDS, and that's the National Electronic Disease Surveillance System. And that is a reporting tool that we use both to report notifiable conditions to the state of Texas and onto the CDC, but it's also used as an electronic reporting system back down to local health departments for national commercial laboratories to report labs of all kinds, including COVID-19, to local health departments. And so as COVID-19 testing capacity has increased, Texas has brought on additional laboratories, and so they have, as that onboarding process has happened, there was a, I don't want to say a glitch, but for a better term, submission errors, backlogs, different things. And so as the technical team at DSHS worked through those, then as those submission errors were worked through, then those backlogs were sent to local health departments. And so those backlogs were sent to all local health departments around Texas, including Amarillo Public Health. And so that's what we saw last week.
Got it. Thank you so much, Casey. I appreciate that. I was also wondering, I was reading that the FDA recently approved a saliva test with results in 3 hours. So do we know if or when that could be available in our area?
I don't know when that would be available in our area. I think that there's still some, pieces that would be worked out. It's only going to likely be available, and the the hospitals would probably have additional information, but from what the EUA says is that would be available in high complex laboratories, so likely hospital laboratories and those laboratories with specific CLIA approval. But if the hospitals want to add more information, then it's welcome.
Okay, thank you so much. I was wondering if Dr. Lamentier, can you go over again the events and ICU numbers at BSA?
Sure. We have 18 total patients that are currently hospitalized. 11 of those patients are in the intensive care unit, and 7 of those 11 are on the ventilator.
Got it. Thank you so much. That was all my questions. I appreciate y'all's time.
Thanks, Vanya. And now we'll go to at this time we'll go to Aaron Langston of KEMR Channel 4. Aaron, how are you this morning?